Hello everyone, today I'm going to discuss an MCQ which is related to the anatomy of the nasal cavity. It says, referring to the anatomy of the nasal cavity, which of the following statements is correct? Option A, the medial wall of the nasal cavity is characterized by three conchae extending from its surface. B, the nasolacrimal duct opens onto the superior nasal meatus. C, the olfactory nerve carries general sensation from the nasal cavities. D, the nasal cavity is lined by non-ciliated columnar epithelial cells. And E, Little's area is found on the anterior region of the medial wall and is a major site of epistaxis. Now, to figure this out, you need to know about the anatomy of the medial and the lateral wall of the nose. Now we can see two pictures. This one right here is showing Little's area, and this is the medial wall of the nasal cavity. And this one right here is the lateral wall of the nasal cavity. On the medial wall of the nasal cavity, we can see that there are 4 to 5 major blood supplies, and all of them are going towards the anterior part. We have the greater palatine artery, sphenopalatine artery, anterior and posterior ethmoidal arteries, and superior labial arteries. Whereas on the lateral side of the nasal cavity or the lateral wall, we see different sinuses, and next we see different turbinates, also known as concas. This is the superior turbinate, middle turbinate, and then we have the inferior turbinate. These turbinate contain certain openings. The inferior most turbinate also contains the opening of the nasolacrimal duct. Now coming back to the question. Part A says the medial wall of the nasal cavity is characterized by three concha extending from its surface. We just learned that the concha are present on the lateral wall. So this is going to be incorrect. Coming to part B, the nasolacrimal duct opens onto the superior nasal meatus. We just learned that it opens into the inferior meatus. So this is also incorrect. Next, part C, the olfactory nerve carries general sensation from the nasal cavities. Now we know that the olfactory nerve is responsible for olfaction, which means the sense of smell. So this is also incorrect. It does not carry general sensation from the nasal cavity. Next, coming to D, the nasal cavity is lined by non-ciliated columnar epithelial cells. The nasal cavity is not lined by the non-ciliated cells. In fact, it is lined by a ciliated and pseudo-stratified epithelium. So this is incorrect. Coming to part E, it says Little's area is found on the anterior region of the medial wall and is a major site of epistaxis. Now this is the correct answer for this question. It talks about the Little's area, which we just discussed, present on the anterior region of the medial wall, and this one here is the medial wall, and it is a major site of epistaxis. The reason for this is that it is present towards the anterior surface of the medial wall, so it is a very approachable site and is a common site for trauma, which can be because of fingers, which can be because of any other impact during road traffic accident, during a fist fight. It also has a very rich blood supply. That is why it is prone to bleed profusely. It has 4 major vessels: the greater palatine artery, which is branch of the maxillary artery; the sphenopalatine artery, which is again branch of the maxillary artery; superior labial artery, branch of the facial artery; and anterior and posterior ethmoidal arteries. These are the branches of the internal carotid artery. Now there is a very interesting mnemonic to learn the names of all of these arteries. The mnemonic is GAPS, GAPS. G stands for Greater Palatine Artery, and as the name indicates, it supplies the palate. Next, we have anterior ethmoidal arteries. These are branches of the ophthalmic artery, which in turn is a branch of the internal carotid artery. We also have posterior ethmoidal artery, which is also another branch of the ophthalmic artery. Next, we have sphenopalatine artery. And the last one is the superior labial artery. And the name labial indicates that it supplies the labia or the lips part. And it is a branch of the facial artery. This was all about how to approach a question of anatomy, how to rule out different options, a brief introduction of Little's area, and a mnemonic of how to easily learn the different branches of the Little's area, also known as Kiesselbach's plexus. Thank you.